Hi everyone, it's Dr. Natasha Iyer here. So, interesting news in Medscape this week talking about personalized glycemic response. What this means is an individual's response to food and how their blood sugar levels change. So, it's interesting because the research started or was published in 2015, and Dr. Carr in about 2016, late 2016, came across this research and said, we need to start doing things differently in our clinic. We see that people can eat the same foods and have completely different spikes in their blood sugar levels. Now, why is a spike in your blood sugar level important? It's because the higher your blood sugar level spikes, the more able you are to take that sugar and store it as fat if you're not using it. The interesting thing that these Israeli researchers discovered was that two people eating exactly the same food, the same quantity, the same everything, and they were getting very different levels. So two people could eat carrots, supposedly healthy, and one could have a almost diabetic level of blood sugar levels. And they gave ice cream to people, and one person would react as if they ate something really healthy, and of course they're happy, right? And it was really interesting to play around with this and have patients do their blood sugar levels. Now, there's a continuous blood sugar monitor that you can have that attaches to your arm, and you can watch your blood sugar change throughout the day in response to what you eat. So if you want to improve your metabolism and know what foods work for you, then doing that will give you a far better insight into what foods work best for you. So you want to eat foods that keep your blood sugar level in the normal range and that return your blood sugar level to normal within 2 hours after you eat them. Now, what is this whole thing about personalized blood sugar response? What they found is that your gut microbiome is critical to affecting how you respond to food. So those 100 trillion bacteria living in your gut affect more than just your immune system and all the other wonderful benefits like your brain health and all of that. These bacteria influence how you respond to the food you eat. Now, what we know about the microbiome is it can change in a very short space of time. Like if you travel by airplane, if you are exposed to something that's toxic to your body, it can change when you change your diet. So it can change when you get an antibiotic. In fact, much of it can be obliterated, and why we don't want you to take antibiotics unnecessarily. So the thing about your microbiome is it's so critical to your health, and this whole thing comes together with what we've been saying all along, that no one diet can be the solution for everyone, and whether it's keto or paleo, or whether you eat low carb and high fat, or if you eat carbs, or if you just follow a low calorie, different people are going to respond differently to the same food. And that's where it starts to have a healthy metabolism and find a way to eat food that works for you and to manage your weight. So hopefully that makes sense. But I thought it was really cool. And the reason it came out in Medscape, I think, in the last couple months is because now they're doing work at Harvard, and so it's become an American thing, and prior to this it was quite the Israeli thing. And at the end of the day, look after your microbiome. Know that antibiotics, foods that have antibiotics in it, affect your gut microbiome. You want to eat lots of fiber. You want to eat lots of plant-based foods because that nourishes your microbiome. You won't know the health of your microbiome, but likely if you have digestive symptoms, so things like gas, bloating, indigestion, heartburn, constipation, IBS symptoms, cramping, all of these things can really mean that your microbiome is very unhappy. And when your microbiome is unhappy, your entire health is not happy. Your microbiome affects everything from mental health to your diabetic state, if you have diabetes, to your blood sugar control, to your metabolism. Your microbiome trains your immune system, and if it's unhealthy, you're prone to autoimmune disease. Oh gosh, I could go on, and I'm told that these Facebook videos should just be a few minutes long. So So, this is why, in the age of precision medicine, we do things like testing your microbiome at Better. And we do a new test called Molecular U, which is actually a Canadian based company. And they can test hundreds of metabolites and talk to us about genetically unique things to you. And it helps us to figure out what your detox pathways are, how you process things, what types of foods you need to eat, what's the state of your microbiome, what's your risk for diabetes. It's pretty fascinating. And again, a lot of it has to do with your microbiome. So in precision medicine and in the personalized glycemic response, just know that you are special and that you're not like anyone else. And so everything that you do has to work for you and your body and your genetics and your biochemistry and everything that's unique to you. So check your blood sugars after you eat, and you might just be pleasantly surprised that a little bit of ice cream might not be so bad for you or your belly fat. Take care. It's Dr. Natasha Iyer.